Our mission is to make life better for children. In order to do that, we really found that we needed to bring the care closer to home. And you're seeing the growth in our community, and we want to grow alongside it.
When we first opened, we had a helicopter pad and we had a transport team. And their sole purpose was to bring the sick patients from Plano back to Dallas. Now we've morphed into a large pediatric hospital where those same ambulances and helicopters are actually bringing the patients to stay at Plano. The option to have the space here has been really due to the foresight that the leadership team had at Children's at the time to have purchased the amount of land that we did. The fact that this is a really full-service pediatric hospital that's not in an urban setting, which is really somewhat unique when you talk about children's hospitals.
This expansion builds upon a rich and storied legacy of the land that it sits on. On the northern end of the Plano campus resides our 100-year-old Texas red oak, also known as the Story Tree, and has offered our patients and team members a respite and a connection to nature.
Everything that we do here is done with the utmost intentionality, and so it's not an accident that our patient-family spaces in the hospital overlook White Rock Creek and overlook the pastures with the horses, because we know how important creating those views to provide the views of nature and the healing environment that nature can create. We want to bring that as close to inside the walls of the hospital as possible.
The tower itself is cutting edge and the newest technology that's available to us today. But the building doesn't do anything without the people who make it happen. We're really lucky to have community involvement in multiple different ways. Our patient families gave us feedback. We had them come in to help us select furniture, to work through design and vision for what we wanted to do and what would be important to them, because they had the experience that a lot of us didn't have.
I was a parent of a child that was very sick, and I've just fallen in love with Children's Health over the years because of the solutions they provide for so many children. The facility provides space for families, whatever their needs may be, and that is so special. When I took the tour a couple of months ago and just saw the thoughtfulness and how this whole building was put together, it's pretty incredible.
The story after story after story that I receive as the superintendent, but also as a parent in the district, because I've also experienced it, the extra care, the attention to detail, the way that Children's Health truly embraces our children as though they are their own children. I think just the easy, accessible access that there is to Children's Health, but I think too, when they are in this facility, just knowing the way, again, that Children's Health really pays attention to those finer details.
Over the last 4 years, we've really tripled the amount of patients that we take care of in our clinic. It also will have more of the equipment and other things that we need to take care of patients. We have child life specialists, we have massage therapists, we have the facility dog program, we have the same surgeons that can do tumor resections or other surgeries that need to happen, interventional radiology, really building all those pieces to make sure that it's world-class care. I think it's an amazing time in science because we are able to be a leader in breeding those new technologies that potentially cure these diseases. Seeing these kids, it changes their entire life.
You know, when I arrived here in 2003, Children's Plano was an aspiration. And so as I reflect on what we've been able to do out there across almost 20 years, we have not only made good on that aspiration, we've made better on that aspiration. And the scope of service, the commitment to the community is stronger than it's ever been.